12 diabetic nerve damage symptoms that could save your feet and health. Diabetes can affect almost every part of the body, but one of the most common and overlooked problems is nerve damage. Many people think numbness or tingling is just a normal part of getting older, but that is not always true. If you have diabetes, these symptoms may be your nerves asking for help before permanent damage happens. Research shows that diabetic nerve damage, also called diabetic neuropathy, affects nearly half of people who have diabetes for many years. Sometimes it can come even before diabetes during the insulin-resistant stage of health. But the good news is that early treatment and good blood sugar control can slow down the damage and sometimes improve symptoms. Remember to watch this video till the end. I have the list of essential vitamins for the proper functioning of nerves towards the end of this video. Nerves carry messages between your brain, spinal cord, muscles, skin, and internal organs. When blood sugar stays high for a long time, it can damage the tiny blood vessels that supply oxygen and nutrients to the nerves. Without enough blood flow, the nerves slowly become weak and stop working properly. This damage usually develops slowly over many years, so many people do not notice it at first. Some people have no pain at all during the early stages, but ignoring the early warning signs can allow the damage to become much worse. Today, we will talk about 12 symptoms you should never ignore. One of the first symptoms could be numbness in the feet or toes. Many people notice that their feet feel less sensitive when walking. Some people describe it as wearing thick socks, even when they are barefoot. You may not notice a small cut, blister, or sharp object under your foot. But when you cannot feel pain properly, injuries can become infected before you even know they are there. That is one reason why daily foot checks are so important for people with diabetes. The second symptom is pins and needles. This feeling is often described as tiny electric shocks or little pins poking the skin. It may come and go at first, especially during the night. Over time, it can become more frequent and spread to larger areas. Research shows this is often one of the earliest signs of nerve damage. The third symptom is burning feet. Some people say their feet feel like they are standing on hot sand or burning coals. Others notice that even light bed sheets touching their feet become uncomfortable. But the feet may look completely normal from the outside. This burning pain often becomes worse during the evening or while trying to sleep. Poor sleep can make diabetes management even harder the next day. The fourth symptom is tingling in the hands. Although nerve damage usually starts in the feet, it can later affect the hands. You may notice tingling in your fingers while reading, driving, or using your phone. Some people find it difficult to button a shirt or hold small objects. But many people mistakenly think it is only arthritis or getting older. The fifth symptom is sharp or shooting pain. Some people experience sudden stabbing pain that comes without warning. The pain may travel through the legs, feet, arms, or hands. It can happen during the day or wake you up at night. Pain like this should never be ignored because it may be a sign of worsening nerve damage. The sixth symptom is muscle weakness. You may notice your legs feel weaker than before. Simple activities like climbing stairs or getting up from a chair may become difficult. Some people begin dropping objects because their grip becomes weaker. But muscle weakness can also increase the risk of falls and injuries. The seventh symptom is poor balance. Healthy nerves help your brain know where your feet are while walking. When these nerves become damaged, your balance may become less steady. You may feel unsteady, especially in the dark or on uneven ground. Many people think they are simply becoming clumsy, but balance problems can be a sign that diabetic nerve damage is progressing. The eighth symptom is foot ulcers that do not heal. Because numbness reduces pain, small injuries may go unnoticed. Poor blood sugar control can also slow healing. A small blister can slowly turn into a serious wound. But early treatment can prevent infections and lower the risk of amputation. Check your feet every day, even if they feel completely normal. While we are in the middle of the video, if you think this video is useful, click the like button and subscribe to my channel. It is a simple help to encourage me to make more videos. The ninth symptom is digestive problems. Many people do not realize diabetes can affect the nerves controlling the stomach, and intestines. Food may move more slowly through the stomach than normal. This can cause nausea, bloating, vomiting, feeling full very quickly, constipation, or diarrhea. Blood sugar levels may also become harder to control because food is absorbed at different speeds. But these digestive problems should always be discussed with your healthcare provider. The 10th symptom is dizziness when standing up. The nerves that help control blood pressure can also become damaged. You may feel lightheaded or dizzy after standing from a chair or getting out of bed. Some people even feel like they may faint. But this symptom can increase the risk of serious falls. The 11th symptom is bladder problems. Some people find it difficult to completely empty their bladder. Others may notice urine leakage or frequent urinary infections. These problems happen because damaged nerves cannot properly control the bladder muscles. But many people feel embarrassed and never mention these symptoms to their doctor. Early treatment may improve comfort and reduce complications. The 12th symptom is changes in sweating. Some people sweat much less than normal, while others sweat too much, especially during the night or while eating. Sweating is controlled by nerves, so changes can be another warning sign. Less sweating can also make it harder for your body to cool itself in hot weather. But unusual sweating should not be ignored. You may be wondering if nerve damage can be stopped. Research shows that keeping blood sugar as close to your target range as possible is one of the most effective ways to slow nerve damage. Better blood sugar control reduces ongoing injury to the nerves. The earlier good control begins, the better the chance of protecting healthy nerves. Regular physical activity also helps improve blood flow to the nerves. Walking, cycling, swimming, and strength exercises can all be helpful. Exercise also helps improve blood sugar levels and overall health. Eating a healthy diet with vegetables, as healthy proteins, whole foods, and healthy fats also supports nerve health. Avoid smoking because smoking reduces blood flow to the nerves. Limiting alcohol may also help protect damaged nerves. Taking diabetes medicines exactly as prescribed is another important step. Your healthcare provider may also recommend medicines that help reduce nerve pain. These medicines do not cure nerve damage, but they may improve comfort and quality of life. Regular diabetes checkups are also very important. Your healthcare provider may test your feet and check your sensation and look for early changes before serious problems develop. Checking your own feet every day is one of the simplest habits that can protect your health. Look for cuts, blisters, swelling, redness, cracked skin, or changes in skin color. If you find a wound that does not improve within a day or two, seek medical advice promptly. But never try to ignore a foot infection because it can become serious very quickly. The specific vitamins involved in neuropathy and their impacts are vitamin B12, an essential for DNA synthesis and myelin production. Deficiency directly damages the nerve sheaths, often resulting in peripheral neuropathy. Common risk factors include vegan-vegetarian diets, stomach acid reducing medications, or conditions affecting the gut like Crohn's disease. Vitamin B1, thiamine, crucial for carbohydrate metabolism. Deficiency is common in those with chronic alcohol misuse or diets high in carbohydrates, leading to a condition called dry beriberi. A fat-soluble version called benfotiamine is often used to treat and reverse neuropathy. Vitamin B6, pyridoxine. Deficiencies can cause nerve issues, but paradoxically, excessively high doses of B6 can also trigger peripheral neuropathy. Supplements containing B6 should be monitored closely. Vitamin E alpha tocopherol, a vital antioxidant that protects nerve tissue from oxidative stress. A lack of vitamin E results in severe nerve degeneration and a loss of physical coordination. But talk to your doctor before taking vitamin E. It may cause severe bleeding, including the risk of hemorrhagic stroke. Research continues to find better ways to prevent and treat diabetic nerve damage. But the strongest protection still comes from good blood sugar control, healthy daily habits, regular exercise, healthy eating, and early medical care. Talk to your healthcare provider before changing your lifestyle or supplement routine. Paying attention to these early warning signs gives you the best chance to slow the progression of nerve damage and stay active for many years to come. If you think this video is useful, click the like button and subscribe to my channel. It is a simple help to encourage me to make more videos.